The use and abuse of anti-anxiety drugs and sleeping pills. Anti-anxiety drugs and sleeping pills are often prescribed for anxiety and insomnia in adults. But do you know the different side effects of using these drugs? We tell you everything you need to know in this article. Nowadays, it is common to prescribe anti-anxiety drugs and sleeping pills to patients. In fact, since 2000, there has been a significant increase in the use of these substances worldwide. Benzodiazepines or benzos are the most widely used psychoactive drug among adults. Controlled use of this substance is an important issue, especially when it comes to psychoactive substances. Many of these drugs can cause serious side effects that simply cannot be ignored. In addition, patients are often unaware of the possible side effects before they start taking them. Prolonged use of this type of substance can lead to the patient developing an addiction or abuse. What begins as a small dose prescribed for a specific situation ends up having a long-lasting effect on the patient's life, both physically and psychologically. What are anti-anxiety drugs and sleeping pills? Anti-anxiety drugs and sleeping pills, anxiolytics and hypnotics, are a group of depression psychotropic drugs. They are primarily used to treat symptoms of anxiety, but can also be used against insomnia. These substances suppress the functions of the nervous system, dulling it and helping to eliminate or reduce symptoms of anxiety. However, they can also affect other brain functions such as coordination and reaction time. Benzodiazepines are the best-known group of anti-anxiety drugs. They can be classified into different types, depending on whether they are long or short-acting. Long-acting benzos include diazepam and bromazepam. Short-acting benzos include alprazolam and lorazepam. The most commonly used drugs in this group are alprazolam, lorazepam and lomerazepam. Today, we often use them as a quick fix to deal with stress or our busy lives. However, if abused, the side effects can be extremely serious. Therefore, it is important to know what it is before you start using it. The use of anti-anxiety drugs and sleeping pills. As we have already mentioned, these drugs are often prescribed for anxiety and insomnia in adults. In the short term, it is a harmless and safe form of treatment. However, if you take them for a long period of time, they can have unwanted side effects. These include the following: increased risk of falls and broken bones, risk of cognitive impairment and dementia, increased tolerance and dependence, increased anxiety. Paradoxically enough, these side effects can even occur in patients who are on the recommended dose. Therefore, experts warn against exceeding the recommended period of use. This means that it should never be used for more than 4 weeks for insomnia or 12 weeks for anxiety. The treatment plan must also include a period during which the substances are gradually reduced. This is especially important in the case of long-term treatment with medication. If the symptoms persist, the doctor must look at alternatives or complementary treatment options. These side effects can occur both due to the patient's abuse of prescription medication or as a result of inappropriate prescription writing by the doctor. In some cases, the patient himself insists that the doctor continue to prescribe these drugs. In others, the doctor prescribes them too quickly. The truth of this routine practice is that the recommended treatment time for these drugs is often exceeded. Many adults take benzodiazepines daily. Unfortunately, these patients are at greater risk of experiencing the side effects mentioned above. At the same time, there has also been an increase in non-prescription drugs among younger generations using benzos as euphoric drugs. This is partly due to the ease of access to these drugs and their excessive and sometimes unnecessary prescriptions. Controlled use of medication. In short, the use or abuse of any drug can have negative side effects, especially for the patient, but also for society as a whole. However, if each of us takes responsibility, we can help promote controlled use of this type of medication. Anti-anxiety drugs and sleeping pills in particular are drugs that can cause serious side effects if they are not used correctly. It is important to always follow the instructions from the doctor. Under no circumstances should you try to self-medicate.